This video of mine is about osteoporosis, which causes bones to become weak and brittle, so brittle that a fall or even mild stresses such as bending over or cuffing can cause a fracture. Osteoporosis related fractures most commonly occur in the hip, wrist or spine. Earlier I posted a short video about osteoporosis on this channel. I hope you have already seen that video, and today I am going to discuss this illness in detail. Well, bone is living tissue that is constantly being broken down and replaced. Osteoporosis occurs when the creation of new bone doesn't keep up with the loss of old bone. Osteoporosis affects men and women of all races, but white and Asian women, especially older women who are past menopause, are at highest risk. Medications, healthy diet, and weight-bearing exercises can help prevent bone loss or strengthen already weak bones. Now I will tell you the symptoms. There typically are no symptoms in the early stage of bone loss, but once your bones have been weakened by osteoporosis, you might have signs and symptoms that include back pain caused by a fractured or collapsed vertebra, loss of height over time, a stooped posture, a bone that breaks much more easily than expected. You might want to talk to your doctor about osteoporosis if you went through early menopause or took corticosteroids for several months at a time, or if either of your parents had hip fractures. Now I will tell you the causes. Your bones are in a constant state of renewal. New bone is made and old bone is broken down. When you are young, your body makes new bone faster than it breaks down old bone, and your bone mass increases. After the early 20s, this process slows, and most people reach their peak bone mass by age 30. As people age, bone mass is lost faster than it is created. How likely you are to develop osteoporosis depends partly on how much bone mass you attained in your youth. Peak bone mass is somewhat inherited and varies also by ethnic group. The higher your peak bone mass, the more bone you have in the bank, and the less likely you are to develop osteoporosis as you age. Now I will tell you the risk factors. A number of factors can increase the likelihood that you will develop osteoporosis, including your age, race, lifestyle choices, and medical conditions and treatments. Now there are some unchangeable risks. Some risk factors for osteoporosis are out of your control. These include your sex. Women are much more likely to develop osteoporosis than are men. Age. The older you get, the greater your risk of osteoporosis. Race. You are at greatest risk of osteoporosis if you are white or of Asian descent. Family history. Having a parent or sibling with osteoporosis puts you at greater risk, especially if your mother or father fractured a hip. Body frame size. Men and women who have small body frames tend to have a higher risk because they might have less bone mass to draw from as they age. Hormone levels. Osteoporosis is more common in people who have too much or too little of certain hormones in their bodies. Examples of these hormones include sex hormones. Lowered sex hormone levels tend to weaken bone. The reduction of estrogen levels in women at menopause is one of the strongest risk factors for developing osteoporosis. Men have a gradual reduction in testosterone levels as they age. Treatments for prostate cancer that reduce testosterone levels in men and treatments for breast cancer that reduce estrogen levels in women are likely to accelerate bone loss. Thyroid problems. Too much thyroid hormone can cause bone loss. This can occur if your thyroid is overactive or if you take too much thyroid hormone medication to treat an underlying thyroid. Well, on this channel I have already posted a video about hyperthyroidism, which is very informative. You can see that video. Okay. Other glands. Osteoporosis has also been associated with overactive parathyroid and adrenal glands. Okay. Now I will tell you some dietary risk factors. Osteoporosis is more likely to occur in people who have low calcium intake. A lifelong lack of calcium plays a role in the development of osteoporosis. Low calcium intake contributes to diminished bone density, early bone loss, and an increased risk of fractures. Eating disorders. Severely restricting food intake and being underweight weakens bone in both men and women. Well, on this channel I have already posted few videos about 3 eating disorders, which are binge eating disorder, bulimia nervosa, and anorexia nervosa. These are all very informative videos. You can see all those videos. Okay. Then another risk factor is gastrointestinal surgery. Surgery to reduce the size of your stomach or to remove part of the intestine limits the amount of surface area available to absorb nutrients, including calcium. These surgeries include those to help you lose weight and for other gastrointestinal disorders. Steroids and other medications. Long-term use of oral or injected corticosteroid medications such as prednisolone and cortisone interferes with the bone rebuilding process. Osteoporosis has also been associated with medications used to combat or prevent seizures, gastric reflux, cancer, and transplant rejection. There are medical conditions which are associated with osteoporosis. The risk of osteoporosis is higher in people who have certain medical problems that include celiac disease, inflammatory bowel disease, kidney or liver disease, cancer, lupus, multiple myeloma, and rheumatoid arthritis. Lifestyle choices. Some bad habits can increase your risk of osteoporosis. Examples include sedentary lifestyle. People who spend a lot of time sitting have a higher risk of osteoporosis than do those who are more active. Any weight-bearing exercise and activities that promote balance and good posture are beneficial for your bones, but walking, running, jumping, dancing, and weightlifting seem particularly helpful. Excessive alcohol consumption. Regular consumption of more than 2 alcohol drinks a day increases your risk of osteoporosis. Tobacco use. The exact role tobacco plays in osteoporosis is not clear, but it has been shown that tobacco uses contributes to weak bones. Now I will tell you the complications of osteoporosis. Bone fractures, particularly in the spine or hip, are the most serious complication of osteoporosis. Hip fractures often are caused by a fall and can result in disability and even an increased risk of death within the first year after the injury. In some cases, spinal fractures can occur even if you haven't fallen. The bone that make up your spine, that is vertebrae, can weaken to the point of crumpling, which can result in back pain, lost height, and a hunched forward posture. Now I'll tell you some preventive measures. Good nutrition and regular exercise are essential for keeping your bones healthy throughout your life. Well, exercise has a big role in so many illnesses. I have posted a good video about the role of exercise in different illnesses. You can watch that video. That is very informative. Okay. Protein is one of the building blocks of bone. However, there is a conflicting evidence about the impact of protein intake on bone density. Most people get plenty of proteins in their diet, but some do not. Vegetarians and vegans can get enough proteins in the diet if they intentionally seek suitable sources such as soy, nuts, legumes, seeds for vegans and vegetarians, and dairy and eggs for vegetarians. Older adults might eat less protein for various reasons. If you think you are not getting enough protein, you should ask your doctor if supplementation is an option. Body weight. Body underweight increases the chance of bone loss and fractures. Excessive weight is now known to increase the risk of fractures in your arm and wrist. As such, maintaining an appropriate body weight is good for bones just as it is for health in general. Calcium. Men and women between the ages of 18 and 50 need 1000 milligrams of calcium a day. This daily amount increases to 1200 milligrams when women turn 50 and men turn 70. Good sources of calcium include low-fat dairy products, dark green leafy vegetables, canned salmon or sardines with bones, soy products such as tofu, calcium-fortified cereals, and orange juice. If you find it difficult to get enough calcium from your diet, consider taking calcium supplements. However, too much calcium has been linked to kidney stones. Although yet unclear, some experts suggest that too much calcium, especially in supplements, can increase the risk of heart disease. The Health and Medicine Division of the National Academies of Sciences, Engineering and Medicine recommend that total calcium intake from supplements and diet combined should be no more than 2000 milligrams per day for people older than 50. Vitamin D. Vitamin D improves your body's ability to absorb calcium and improves bone health in other ways. People can get some of their vitamin D from sunlight, but this might not be a good source if you live in a high latitude, if you are housebound, or if you regularly use sunscreen or avoid the sun because of the risk of skin cancer. To get enough vitamin D to maintain bone health, it is recommended that adults ages 51 to 70 get 600 international units and 800 international units a day after age 70 through food or supplements. People without other sources of vitamin D and especially with limited sun exposure might need a supplement. Most multivitamin products contain between 600 and 800 international units of vitamin D. Up to 4,000 international units of vitamin D a day is safe for most people. Exercise. Exercise can help you build strong bones and slow bone loss. Exercise will benefit your bones no matter when you start. But you will gain the most benefits if you start exercising regularly when you are young and continue to exercise throughout your life. Combine strength training exercises with weight bearing and balance in exercises. Strength training helps strengthen muscles and bones in your arms and upper spine. Weight bearing exercises such as walking, jogging, running, stair climbing, skipping rope, skiing, and impact producing sports affect mainly the bones in your legs, hips, and lower spine. Balance exercises such as Tai Chi can reduce your risk of falling, especially as you get older. Swimming, cycling, and exercising on machines such as elliptical trainers can provide a good cardiovascular workout, but they do not improve bone health. Now I will tell you about the diagnosis of osteoporosis. Your bone density can be measured by a machine that uses low levels of X-rays to determine the proportion of minerals in your bones. During this painless test, you lie on a padded table as a scanner passes over your body. In most cases, only a few bones are checked, usually in the hip and spine. Now I will tell you the treatment. Treatment and recommendations are often based on an estimate of your risk of breaking a bone in the next 10 years using information such as the bone density test. If your risk is not high, treatment might not include medication and might focus instead on modifying risk factors for bone loss and falls. There are treatment options such as bisphosphonates for both men and women at increased risk of fracture. The most widely prescribed osteoporosis medications are bisphosphonates. Examples include alendronate that comes with the name of Binosto or Fosamax, risedronate that is comes with the name of Atelvia, ibandronate that comes with the name of Boniva, and zoledronic acid that comes with the name of Zometa. Side effects include nausea, abdominal pain, and heartburn-like symptoms. These are less likely to occur if the medicine is taken properly. Intravenous forms of biphosphonates do not cause stomach upset but can cause fever, headache, and muscle aches for up to 3 days. It might be easier to schedule a quarterly or yearly injection than to remember to take a weekly or monthly pill, but it can be more costly to do so. Monoclonal antibody medications. Compared with biphosphonates, denosumab that comes with the name of Prolia or Xgeva produces similar or better bone density results and reduces the chance of all types of fractures. Denosumab is delivered via a shot under the skin every 6 months. If you take denosumab, you might have to continue to do so indefinitely. Recent research indicates there could be a high risk of spinal column fracture after stopping the drug. A very rare complication of biphosphonates and denosumab is a break or crack in the middle of the thigh bone. A second rare complication is delayed healing of the jawbone, that is osteonecrosis of the jaw. This can occur after an invasive dental procedure such as removing a tooth. You should have a dental examination before starting these medications, and you should continue to take good care of your teeth and see your dentist regularly while on them. Make sure your dentist knows that you are taking these medications. Hormone-related therapy. Estrogen, especially when started soon after menopause, can help maintain bone density. However, estrogen therapy can increase the risk of blood clots, endometrial cancer, breast cancer, and possibly heart disease. Therefore, estrogen is typically used for bone health in younger women or in women with menopausal symptoms that also require treatment. Raloxifene that comes with the name of Evesta mimics estrogen beneficial effects on bone density in postmenopausal women without some of the risks associated with estrogen. Taking this drug can reduce the risk of some types of breast cancer. Hot flashes are a common side effect. Raloxifene also may increase your risk of blood clots. In men, osteoporosis might be linked with a gradual age-related decline in testosterone levels. Testosterone replacement therapy can help improve symptoms of low testosterone, but osteoporosis medications have been better studied in men to treat osteoporosis and thus are recommended alone or in addition to testosterone. Bone building medications. If you cannot tolerate the more common treatments for osteoporosis, or if they do not work well enough, your doctor might suggest trying a teriparatide that comes with the name of Forteo. This powerful drug is similar to a parathyroid hormone and stimulates new bone growth. It is given by daily injection under the skin. After 2 years of treatment with teriparatide, another osteoporosis drug is taken to maintain the new bone growth. Then another drug is abaloparatide. This is similar to parathyroid hormone. You can take it for only 2 years, which will be followed by another osteoporosis medications. Then there is a drug known as romosozumab that comes with the name of Evenity. This is the newest bone building medication to treat osteoporosis. It is given as an injection every month at your doctor's office. It is limited to 1 year of treatment followed by other osteoporosis medications. And now I'll tell you some lifestyle and home remedies. The suggestion which I'm going to tell you might help reduce your risk of developing osteoporosis or breaking bones. Do not smoke. Smoking increases rates of bone loss and the chances of fracture. Avoid excessive alcohol. Consuming more than 2 alcoholic drinks a day might decrease bone formation. Being under the influence of alcohol also can increase your risk of falling. Prevent falls. Wear low-heeled shoes with non-slip soles and check your house for electrical cords, area rugs and slippery surfaces that might cause you to fall. Keep rooms brightly lit. Install grab bars just inside and outside your shower door and make sure you can get into and out of your bed easily. Now I'll tell you something about alternative medicine. There is limited evidence that certain supplements such as vitamin K2 and soy can help lower fracture risk in osteoporosis, but more studies are needed to prove benefits and determine risk. Well, this was my video about osteoporosis. It was a detailed video. I hope you will like this video. If you have any questions about osteoporosis, you can post in the comment section.